So today we're talking about pico lasers and applications across all skin types. Why pico and what pico? This is actually a hard subject to deliver because it's basically based upon chromophores and physics. So why do we use picosecond laser technology? Because we want to reduce the amount of side effects or possible side effects. In other words, we want more photomechanical rather than photothermal. We don't want to heat up the skin. We don't want to blow up pigment so much as to cause a heat transfer. So basically, when you use a pico, you've had less adverse reactions, right? What pico? And what we have to consider, we base everything on physics and chromophores. That's it. So I'm not here to sell you a device. I'm just here to talk about physics and chromophores in a simple way as possible. Don't worry about the histology, but when you see this graph, basically it demonstrates the main players, the three main wavelengths, your 532, your 755, or the other competitor, the 730, and the 1064. So remember, only three wavelengths you need to worry about. And it shows that the greatest amount of melanin to hemoglobin is with the 755. And that's what you've got to take home from that, right? So when Emil Tenggedi did this study, he shows that the 755 creates a lot less downtime, right? It's a lot less inflammation and a lot more collagen remodeling compared to your 1064 or your 532. It's all about mitigating side effects and risks with the correct wavelength. So what pico? Wavelength matters. So 755 is not always the answer. 755 is the Picosure, right? But I'm not saying it's the best wavelength out there because, as we know, there's optical penetration of different wavelengths. The longer the wavelength, the deeper it goes. Can we adjust the volume, thanks, guys? Thanks. So when do I need a 1064 laser? It's this, if I'm treating deep dermal conditions, right? So for conditions like this, otitis that lie really deep in the skin, in the reticular dermis, this is where the 1064 can come in handy because I need to go down deep, right? So when we look at the otitis, we can see that 755 can help it as well. And that's the Picosure Pro. But the Pico way probably does a better job. So if you're treating dermal conditions like post-inflammatory hyperpigmentation, like what we have to do as a tertiary referral center, right, we can treat PIH better using a 1064. When it comes to Hori's nevus, right, I used to think Hori's 1064 because it's deep, but recent publications show that in 25% of the cases, there's some concurrent melasma. So maybe the 755 may be a compromise if you're treating that. So wavelength matters, right? For deep dermal pathology, it's your high-powered 1064 is better than your 755. That's proven by histology, that's proven by physics. So if you're treating otitis and PIH, get yourself a 1064. But in our clinic, 95% of all conditions we treat are these. Pigmented lesions, a mixed pigment, pigment in darker skin types, melasma, more superficial dermal pigment, but also we use that to remodel skin. And this is where the 755 excels over the other wavelengths. So why 755? Remember I showed you that graph. We want to reduce the amount of pinpoint bleeding because your competition for hemoglobin is a lot less, right? We want to mitigate those risks. And this reduces PIH, but it's also more efficient at targeting pigment. And we all do this with an increased amount of collagen and virtually little or no downtime. So what is the Picosure Pro? It's an upgraded version of the Picosure. We can go into the details at a later stage, right? But if you're treating mixed pigment, if you're treating, basically your melasma, your dermal, superficial dermal pigmentation, your lentigos, possibly the 755 is your best option for this. So fractionation basically means high-powered in small areas. So we're not delivering a full beam, we're fractionating, much like other fractional laser resurfacing devices. So pico lasers, it goes beyond the selective photothermolysis, right? It is an important concept to understand. Instead of blowing things up, what we want to do is we want to create controlled epidermal injury. And when that happens, we get little LIOBs, which is your laser-induced optical breakdown or optical bodies, right? And they're the ones that are in your epidermis, and they're the ones that stimulate your collagen because it blows up your cells, but that creates a shock wave, and then you've got your growth factors and cytokines as well. So there's more improvements over this compared to the original Picosure, right? And it's a faster treatment time, it's more flexible, and it's got more fluence, but also the shot count's a little higher with their lenses. So it can treat other pigment types. But like I said, if you're running a tertiary referral center and you want to treat others all day, I still need the 1064, right? But for other conditions, keep it simple, right? Keep it very simple. So just to block out the other competitors, this is their protocol. 13 sessions, right, using 2 devices to get an improvement in pigment. And that's their standard operating protocol. They still teach that now, right? So when you look at the total amount of pulses, right, and the handpieces changes and lens changes, 21, right, 21 over 13. So this is my first patient I treated using the new device, Asian male, Picosure Pro. This is what I did. 1 session, 1 wavelength, 1 setting. Right? And the treatment time is 7 minutes 30 minus the 18 seconds I had for a break midway. So it's very, very fast. Right? And compared to the competitors, which often takes many more treatments. So can I get the same result with other picosecond lasers? Yes, I can, but it's less predictable. My laser time takes me a lot longer, right? And each session takes me a lot longer to complete. So when you look at the leading competitors and see how complex it is, the Picosure Pro makes it really easy. And for you guys like driving fast cars, when we go into a race car, we just want simplicity, right? We want just know how to actually use the controls and just go, right? The more tweaks you have, you can do it, but often simple is best, especially if you want to get in and just get stuff done. So now we'll talk about melasma. And melasma is a humbling condition to treat. There are many studies showing the efficacy of different wavelengths, but I was a little bit apprehensive in regards to the 755. And there are many studies, like I said, that show it's effective. And these are the studies that are done by Picosure, yeah, by Cynosure. So these are all company slides. And then we decided to use Pico for melasma just last year. Ali?
Yes. So typically, like Davin was just saying, we'd always reach for a 1064. We've changed over to the 755, more selective. So in this patient here, mandibular melasma, some isolated lesions. We've gone in with a full beam to the isolated lesions and then a larger spot size to do some dermal toning on her mandibular melasma with a good clearance after 1 session. Again, it's just a selective 755 in comparison to the 1064.
Once again, a very easy protocol. We're using 1 wavelength. In this situation, we had to use 2 handpieces. One was basically the flat to treat the isolated lesions, and the other, the focus. That's it. 1 wavelength, 2 settings.
Same situation here. Again, it was just 1 setting, so 1 full beam, 755, 8mm spot, low fluence, good clearance after 1 session.
This was my patient 2015, I think so, 8 years ago. And once again, just using 1 setting. In that situation, I used the focus, 6mm, 1 setting. I think we did it in 2 sessions, right? Super easy. Ali?
Yeah, this was a focus as well, so the fractionated beam, where we're not concerned with creating too much of that heat because of the melasma. She's got that kind of background sun damage where we can use the high energy, so 1 setting being the fractionated beam at high energies to pick up on the pigment, but also create some of the LIOB induction.
Yep. So guys, just to remind you, melasma etiology is very complex. It's not just lasers. The mechanism of action is very different, like Alison said, compared to your 1064, which is you're using your nanosecond laser. That one, you're suppressing your melanocyte activity, right? Well, this one, we're just blowing shit up, but doing it in a very low fluence, right? So it's very, very different. So guys, don't forget your medical therapies, because that's first line. Certainly the physical therapies like lasers, peels, they are towards the upper end of the tier. Okay, so just to summarize, melasma, much faster clearance than nano, right? Much, much faster. No downtime compared to novel peels, whether you use your Dermamelan or Cosmedicon peels. And it's safer, much safer than thulium lasers. We use thulium 1927 Fraxel, a whole heap, a lot, but we do not use it for melasma. Now, let's talk about pigmentation, just general pigmentation, so you understand what your target is. Once you know your target, you can actually treat it with relative safety and efficacy. So when we're treating Asian skin types, probably about 60–70% of our use for Pico is Asian skin types. We can get good dermal remodeling. This is my patient, but that's generation 1, right? 2016. That's after 2 treatments of Picosure Focus, right? Ali, this one?
Yes, so this is Gen 2, which essentially means now we can alter the fluence. So again, creating LIOBs, but now we've got the option to increase that fluence and create more of the LIOB. So again, one setting of the focus fractionated beam.
This is me, right? So this is me, 2016, 2 sessions, right? My lace time, I think about 7 minutes, 20 each session. I get better skin quality now than what I had 8 years ago. And this is just two sessions using the Picosure, right? Not even Picosure Pro. I can go higher now. Ali?
Yes, this one here is, again, only 755, obviously. Again, we're going more for isolated lesions. You can see some of her larger spots, chasing that with a full beam and then just changing straight over to the fractionated beam to pick up on the background pigment and create, again, LAOB remodeling.
Good dermal remodeling with this, and once again, extra layer of safety as compared to using a 532. It's all about safety, yeah. Ali, this is good remodeling as well,
yeah.
Plus pigment reduction in darker skin types.
Yeah, would have often had to have chosen a 532 for selected spots like that, but now with a more selective,
yep.
use
Cool.
755.
So guys, just to summarize a couple of things, do you still need a nanosecond, a Q-switch laser? And this is all about, I guess, how you want to roll the dice, right? So in this situation, I did use a 532, the old-fashioned Q-switch laser. In this situation, I was lucky, right? I got it without PIH, right? But if you get the same endpoint, 10 patients, in at least 1 in 4, right, you're going to get PIH. It's all about mitigating the risk. You can do that with the 532 as well. You can do that to 532 Pico, right? You're going to get it. It's going to be less PIH. And all of this is in the literature. So I try to get my staff to actually get some PIH. That way we're not under-treating patients, but just as long as it's not more than that 5% is considered cool, okay? So when the company says we've got a Pico at 532, you are going to reduce your PIH, but the 755, you're going to reduce it even more, right? So I'll let you guys make that call. So this is the other competitor's device, yeah, Ali?
A little bit of mixed pigment. You can see it's got that kind of grey tinge to it, which then alludes to the fact that it is more of a dermal pigment, which is now why we would change to a 1064 to get the depth.
Yeah. So it's for something like this, you know, for complex stuff, certainly Pico is good. Dark circles, we do a lot of that. Once again, many different causes. I did this with the 755, yeah? And this is mixed pigment as well. This is last minute or so, I'll say, this is exciting because now we're treating pigment skin type 1, skin type 2. With the increased amount of power that you get with the Picosure Pro, it allows me to treat lighter skin types with a lot higher fluence with a lot more safety. So this is one treatment only. And now we're working on treating this and then compare it with thulium lasers, which is your Fraxel laser. So the beauty about this treatment compared to Fraxel is this. It's got a lot less downtime, right? And from your point of view, it's a lot quicker. It's 8-minute treatment. Your consumables are $4 compared to the $80 for the Fraxel. Your recovery's probably about 24, 72 hours. And the safety margin is very high, especially if you're trying to treat patients with melasma. So this is the proposed phenotype for hyperdense Pico. So guys, if I can summarize in the next 30 seconds, diagnose, because that will lead to less adverse outcomes. If you can't figure it out, use some sunscreen, use some azelaic acid. Last thing I'll say, keep things simple. I just did a webinar with Prof. Goodman 3 days ago, right? And I'm very good friends with Prof. Beckel. We talk every week. We talk about Picos. They can't figure it out. They've been lasing since I was in kindergarten, right? They can't figure it out. I've got no way of figuring it out, right? But with a Pico, keep it simple. 1 wavelength, 1 or 2 settings, you'll get there, right? Very, very important. So the take-home message, we do believe that Pico is the best laser for ethnic skin type. If your primary focus is on treating complex stuff that's deep, look at the competitor, right? It's super easy to understand with the Picosure Pro. It's a faster treatment times. And I think it gives you better outcomes compared to thulium fraction lasers with a suitable phenotype. Thanks for your attention, guys.